Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Alcohol is a leading preventable cause of cancer in the U.S. Johns Hopkins researcher Johannes Thrul talks to Stephanie Desmon about how there's no safe amount of alcohol when it comes to cancer risk, how norms have started to change around drinking, and how the U.S. needs better public health communications, including updated warning labels on alcoholic beverages. Let's listen.
Johannes Thrul, thanks so much for joining me.
Thank you so much for having me.
So earlier this year, you co-authored an op-ed with your colleague Elizabeth Platts, and this first sentence really struck me, and it said, alcohol causes cancer, and we should be drinking less of it. Unpack that for me, please.
Yeah, so the evidence has been clear for quite a while. So alcohol is grouped together with cigarettes, right? Tobacco smoking, and asbestos is a group 1 carcinogen. But what I would put forward is that this is actually not widely known in the population. We said this in the editorial, and so I will reiterate it here, that the public health and the cancer prevention community has some work to do to get this message out into the population, so folks know and can make informed decisions based on what the actual risk looks like.
So let's break that down a little bit. So what kind of risk are we talking about, and what kind of cancer?
Yeah, so 7 different kinds of cancer. You can imagine it as every single thing that the alcohol touches on its way through your body, right? And the risk is, we know that at this point, there's no safe level of alcohol use, and that the risk increases in proportion to the amount of alcohol that is being consumed. So that tells us there's no safe level of alcohol use, that even what we might consider small or moderate amounts can already increase your cancer risk.
Interesting, because I think that the messaging over the years has been that a moderate amount of drinking is okay. Why has that been the message, and how do we combat it?
Yeah, so the science on this particular thing has been changing over the last few years with more and more robust evidence coming out that demonstrates that even moderate amount of drinking is not safe and that there are no appreciable health benefits. That message really came from early observational studies that looked at people who drank moderately versus those who didn't. But what those studies didn't do well, and what was confounded there, is that moderate drinkers tend to be healthier at baseline, they have better healthcare access, and a bunch of other things. So you can't compare these groups very well and then make a causal conclusion that the alcohol is what gives health benefits. When we use better methods, for example, one effect that was baked into these earlier studies is what we call a sick quitter effect, which is folks who have stopped drinking because of health problems. And then if at the time when a study is conducted, they don't drink, they get grouped in the non-drinking group, but they have already accumulated all of the harms based on their previous consumption. So studies that do a better job of separating out those groups and making sure that there is a relatively, I would say, clean group of non-drinkers don't see those benefits that are associated with moderate drinking. And so what this tells us is there's really no safe level of alcohol specifically for cancer, and that some of the benefits, specifically the cardiovascular benefits, may be mostly due to methodological issues in the early studies that were conducted in this space.
So what kind of damage is alcohol doing?
Yeah, so the main ingredient of alcohol is ethanol. And ethanol in the body gets metabolized into acetaldehyde. And acetaldehyde damages DNA and can impair DNA repair. And that's the main mechanism by which it causes cancer.
And you say this is the leading cause of preventable death, alcohol use.
It is one of the leading causes. I mean, if we look at the deaths in the USA, we have about 140,000 a year based on alcohol. Tobacco kills more people by some margin, but alcohol is certainly up there in terms of the number of people it kills. So one of the main preventable causes of death in the US.
Earlier this year, President Biden's Surgeon General recommended warning labels be put on alcohol. Talk to me about what kind of warning labels we have now and what these new ones could look like.
The current warning labels on alcoholic beverages are related to drinking during pregnancy and drinking and driving. And those are insufficient, I would say, to educate the public on specifically the link between alcohol consumption and cancer. Now, we know from a lot of other research on warning labels, like say in the tobacco space, what makes for a successful and impactful warning label. And those tend to be visual warning labels that have certain colors, that have a certain size, right? That they really capture the attention of the consumer. And I think all of these things would be needed in the alcohol space as well, on alcoholic containers.
So, for example, I can't go and, smoke anywhere I want anymore these days. It's just it's frowned upon, right? And the link between lung cancer and smoking seems incredibly obvious. Why is it that people have taken tobacco warnings more seriously?
In tobacco, we have had a bit of a different trajectory in terms of denormalizing use, and it has predominantly started happening through this avenue of harm for others, right? That cigarettes that you smoke are not just impacting yourself, but are also impacting all of the bystanders around you, and specifically in enclosed spaces. And that was the first kind of avenue that served to denormalize smoking in particular. And for alcohol, the harm to others is not quite as obvious. So that just makes it more difficult to communicate. There is harm to others, particularly if you're thinking violence, for example, right? And there is more and more research looking into this, but it's still, I think in terms of communicating it, it's more difficult and it's not quite as obvious. And so I think we have our work cut out for us to move beyond, I would say, alcohol being a completely accepted part of how we socialize and do a better job at denormalizing it and allowing people to make informed decisions and live lives that don't necessarily have to have alcohol consumption as part of it.
I have to ask, knowing all this, do you drink?
Do I drink? I drink extremely small amount at very low frequency. Yeah.
Mm-hmm.
So I don't know. I honestly, I couldn't really give you a good number because it's so rare, but maybe a drink a month at this point.
When people ask you why you're not drinking, does this come up, the health risks? Do people want to hear it or do they absolutely not want to hear it?
Yeah, I mean, I think there's a bit of a selection and socialization effect there, right? Like people know that I'm a substance use and addiction researcher, so it's what they get when they talk to me about these things. I tend to, if people ask me, I'm very open about my reasons. And I try to give information that people find relevant and that helps them make informed decisions for their own lives without preaching, because I think there's an aspect there that, it drives people away rather than convinces them. But that's always been my argument also with warning labels, right? This is not the paternalistic nanny state speaking. It is allowing people in a situation where we have about more than half of the population that doesn't know the cancer risk of alcohol. I think there is a necessity here to make sure that folks know what they are putting in their body and what the consequences are. And for me, for my own consumption, this goes back to, I want to say maybe around 2012, when I had, keep in mind, at that point, I'd already had a master's degree in psychology, was working in addiction research. I didn't really know this cancer risk of alcohol, and I didn't know the degree. And so I was in a seminar with a leading alcohol epidemiologist, and I would say my alcohol consumption has been severely impacted by knowing that, by really getting firsthand kind of evidence from somebody who's a leading researcher in the space. And so I feel like for me, being more aware of the research there and the data that do exist has certainly shaped my own decisions. I think it's important to just get the truth out there.
Well, we know that tobacco is bad for us. We just know that. It's just a fact of life. And you're saying that alcohol is almost as bad as tobacco. Why don't we know about this risk?
I think communication has been insufficient in this area. And when you look at internationally, right, like the warning labels for tobacco, for example, have been a lot more prevalent in a lot more countries. At the population level, information on smoking has just gotten out a lot more. I think we've been treating the alcohol industry differently from the tobacco industry. And I think it's time that we get the evidence-based, unbiased information out there to the population.
And it's probably very difficult. I mean, you watch a football game or anything else, really, and all you see is every other commercial is either for drug ads or for alcohol. And in the alcohol ads, people are just having a wonderful time. So is there an appetite for being told something else?
I mean, there's a question there of if there needs to be something else, or if a first starting point could be, why do we still allow ads for a product that we know is carcinogenic associated with sports events? I would say, apart from the cancer risk, alcohol is, for example, really bad for recovery after workouts, right? And so the association of alcohol in sports, I mean, for the spectators, maybe, right? But if you're a serious athlete yourself, you will know that alcohol is not good for you and for your recovery and for your body. And so getting alcohol advertisements out of that space is, in my mind, the first target, right? And there's no one silver bullet that will solve this problem. And in the editorial, we'll talk about this too, that cancer warning labels can be part of a comprehensive strategy and should be. But at the same time, there are other tried and tested alcohol regulation strategies to make alcohol less affordable, less available, and decrease the appeal. And that could be taxes, that could be restrictions on the density of outlets and the hours when alcohol is being sold, and bans on advertisements.
So I guess we really have to address the cultural norm of drinking, perhaps, to get people to change their ways.
Yeah, for sure. You know, in tobacco, it's also, you can't always cleanly say this is what was done in the public health space and has impacted norms. There is back and forth between social norms in society and what kind of laws and regulations are being implemented. And I think we're seeing something similar happen in the alcohol field, where now if you look at, for example, the drinking patterns and habits of the different generations, right, that we now know young people today are drinking a lot less frequent, lower doses than, say, when I grew up, when I was a young person. And so culturally, there's already something happening. There's a change happening. What we can also track is that there is much wider availability of non-alcoholic drink options. For example, if you go to a restaurant today, right, you will get a menu that has a lot more options than, say, you did maybe 10 years ago. So I would argue we're already seeing changes happening all around us, and that trend will likely and hopefully continue.
So what should the next step be here?
I think as a public health community, we have to do a better job of getting this knowledge out there and making sure that the population is aware of the risks of alcohol and the absence of benefits that at this point in my read of the literature has been firmly established, that there is a cancer risk and that the benefits that maybe we thought for the longest time would accrue, especially for moderate drinking, are largely a myth.
Johannes Thrul, thank you so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.